Patients lying in beds they no longer need. We know it as bed blocking, but the reality is it clogs up and slows down the whole system. And figures released today for April show it at close to record levels. The winter pressures were over, but the beds didn't clear. And lots of targets across the health service were still being missed.
I just keep seeing him and then thinking I could have done more.
Would he be alive now if he was seen too quicker?
Tammy and Wayne have seen the NHS strain close up. Their dad Brian died in April. He went into hospital in pain and struggling to breathe. But he had to wait for 2 hours before anyone realised he was having a heart attack.
Crying, helpless in pain, on his knees, underneath a chair, with people seeing him for over an hour and a half.
It's heartbreaking that a 51-year-old man had to sit there and go through that pain for all that time.
The hospital in Stoke-on-Trent which treated him says it's investigating exactly what happened to Brian's care and will keep his children informed. But his children say their father was neglected by staff, failed by the NHS. Bed blocking caused more than 160,000 days of delays in April. That's the second highest on record. The key A&E waiting time figure did improve slightly to 90%, but that's still 5% short of the government's target at 95%. And it's worse than at the same time a year ago, when more than 93% of patients were seen in 4 hours. Overall performance has improved, NHS England told us today, and they said failure to move patients out of beds is mostly an issue with social care, meaning some patients have nowhere else to go. So is A&E equipped to be bearing the brunt?
We've seen a long-term decline in A&E performance over the last few years. Part of the reason is growing demand. It's growing at over 2% a year, and the resources to deal with it aren't necessarily growing at the same rate.
Bed blocking is costly. These latest figures equate to a bill of some £45 million. But a blocked bed is a symptom of a problem elsewhere. The NHS is now out of its most demanding months, but its vital signs still show a system that's struggling. Dominic Reynolds, 5 News, Stoke-on-Trent.